Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
It is that time on a Thursday. We get together with Lee Aase and Dr. David Strobel at the HELPcare Clinic here in Austin. Gentlemen, good morning.
Good morning.
Good morning. Yeah, John. Well, we have a special extra bonus today to announce. So it's not just Dr. Dave and me today, but we're pleased to announce that Stephanie Kimmis, who's a nurse practitioner, has joined the team, and it's her first day with us today, and so she's joining us for us to be able to introduce her to the community as well.
Well, fantastic, and it really shows how this clinic and this idea that you have brought to Austin is taking off, and that you're expanding and offering as much service as you can to the people of the Austin and surrounding area.
Yeah, absolutely. And so first, I'd like Dave to talk a little bit about the idea of bringing Stephanie on, and then have Stephanie tell a little bit about her background and experience and interests, so that folks in the community can get to know what's driving her to be involved in this.
All right, fantastic. Dr. Dave, take it away.
So the main thing with HELPcare Clinic, the real secret to it is its financial position and how it gets paid, and that allows us to do a whole lot of things that don't really work in the normal payment structure. So that's really the special thing. And then each person that works there, which right now has been just me, we have areas of expertise and experience and all that kind of stuff, but I don't know everything. I like to tell people I'm not young enough to know everything. And so as you start expanding, what you'd like to do is to bring in other people that have differing levels of expertise, different perspectives, maybe even opposing perspectives, but then you have a forum to be able to discuss and review and bounce things off each other, and that keeps people thinking on an ongoing basis about how to manage cases and patients and all of that. And so what we want is, we don't want to just duplicate me. We want to actually expand what I can do, because I can't do everything. And Stephanie brings us some areas of expertise that are richer in some ways than the things that I can do. And that's exactly what we want. We want to broaden things out so that we have a variety of folks.
All right, very, very good. And with that, we should go through the formal introduction once again.
So, Stephanie, please tell our folks about your background and your interests.
Absolutely. Good morning. I'm happy to be here. So my background is, my first love is pediatrics. So I became a pediatric nurse practitioner, so seeing children, newborn up till, college age. And I graduated from the University of Minnesota Twin Cities in 2001. And from there on, I decided, some of these parents could use help as well. And if they're feeling better, health-wise, then the children are going to be better off. And so I went back and I got my family nurse practitioner certification. And so therefore I can see all ages, like Dr. Strobel does, but I really have an expertise in the children or pediatric. And I think I bring that to this clinic, as well as a desire to work with women on all kinds of things, not only gynecologic care, but all kinds of things that affect women. So, and I think having me here also provides an option for women who, would rather, speak to another woman. And I'm really looking forward to that here.
And kind of the point that was brought up earlier by Dr. Strobel is talking about how just having another voice there in the office, it gives a different perspective or maybe a different view of a particular issue. Not that you practice medicine any differently, but you may just see something a little bit differently and maybe open up a different option or a different idea of trying to diagnose something.
Absolutely. Absolutely. And I think we all have our experiences, our past experience that brought us to this point and where we're at in our knowledge base. And we can learn from each other. And that's the whole point of, collaborating with another person in the practice. Absolutely.
Yeah, I think one of the things that...
Go ahead.
Oh, well, yeah, just one of the things that we're expecting is that there'll be some times when, Dr. Dave and Stephanie will be seeing patients together, sharing a visit with a patient. Mm-hmm. And that's part of how they, communicate and kind of gel together as a team. And then others will see the patients individually, but then just talk with each other about, and bounce ideas off each other.
Mm-hmm. I like to use an analogy when talking about medical expertise. I had a student one time that gave me a cup, and it was a mug, with a theme on it, and it said, "Please don't confuse your Google search with my medical degree," which is, I understand what she meant, but the problem is that that's not actually true. Somebody that does good research can actually be more educated about their medical condition than I am, and of course the internet allows that to happen. What it should say is, please don't confuse your medical or your Google search with my medical expertise and experience. And that is something that happens over a period of time. So I think of, a new physician or clinician who has recently completed training as a cook in a kitchen that is good at following a cookbook. And if they don't keep doing that, they're never going to be a master chef. But once you are a master chef, you don't really use the cookbook very much. In fact, you start writing your own recipes and things. So when you have two different folks that have a fair amount of experience, each one of them might actually make a wonderful soup, but it's not the same soup. So the principles are the same in management of practice and medical care, but that doesn't mean that it's done exactly the same way. And patients and doctors don't want it to be done the same way. We want to be good quality clinicians, but that doesn't mean that we're always doing things the same way. And so having more people so that, well, I like the way she does it, or I like the way he does it. That's the point, is that we broaden out our product by broadening out the perspective and the expertise of the folks who work here.
Yeah, it's a little bit like taking a journey. If I want to drive to the Twin Cities, I can take I-35, but there are multiple different ways to get to the end result, and it's just whatever works best for a particular person.
Right, exactly.
That's right, and that can be different for everybody, right? Everybody's got their own journey they're on.
Or different for the same person, two different circumstances.
Mm-hmm.
Exactly. Right.
Well, this is very exciting, and being able to expand and bring in other voices, other eyes to be able to help the people of Austin, and that's really what the HELPcare Clinic is all about, is just providing the services that people have been looking for in kind of a old school approach, yet using modern technology and making it personal.
Yes.
Yep. So
That's
the other
right.
thing that I'd stress with this is going to give us more days per week that we're able to be seeing patients. So some days Stephanie's going to be working here, and Dave's still working with the pipe trades clinic, part time. So sometimes she'll be here. Sometimes they'll both be here together, and then sometimes it'll be just Dr. Dave. So where we have been from now on, I think we'll be able to go every Wednesday, Thursday, Friday, Saturday morning seeing patients. We'll be adding some Mondays and Tuesdays with Stephanie able to join as well. And then again, there'll be some days when they'll both be working together. But what it'll just mean is that patients will be able to be seen on a more timely basis. And as we're moving toward that being open 5.5 days a week, it's increasing the value for our members.
Absolutely, and we've got about just over a minute to go. We should talk about that value as we are still in that discounted sign-up period.
Yep.
So let's talk about that and let people know they can still become part of the HELPcare Clinic.
Yeah, right now through the end of May, through May 31st, we're offering 20% off for our early bird members. So these are people that are joining now. While we're not still quite fully up to speed on everything that we're going to be having, but they're going to save 20%. So $119 a month for a single, $199 for a couple, $279 for a family. And those are 20% off the full rates that will go into effect later this summer when we're open that 5 days a week. So it's they can stop and see us at 308 4th Avenue Northwest, which is just a block east of St. Augustine's. They can call us at 279-2345. Visit us at helpcare.health, or just stop in anytime to see. We'll be glad to give people a tour and show them around and show them the difference that HELPcare Clinic can make for them.
Absolutely. This is exciting news, adding to the staff there. Welcome, Stephanie and Dr. Dave and Lee. Look forward to visiting with you again next Thursday about the HELPcare Clinic.
Thank you so much.
All
right.
Have a blessed day.
Thank you very much, and we'll talk to you next week.